heard of fibromyalgia, maybe in passing, maybe you know someone who has it, maybe you're living with it, but what exactly is it? Who is most likely to have it? Dr. Angela DeRosa is here to answer some of these questions for all of us. And gosh, looking through some of the symptoms, some of us in the newsroom were wondering if we had it.
I think we all could relate to the symptoms of fibromyalgia.
Yes.
Unfortunately, a lot of patients are walking in with these diagnoses of fibromyalgia, and 80 to 90% of them don't actually have fibromyalgia.
Okay.
The problem is it's really a true misfiring of the nerve beds in the muscles and joints and everything. But unfortunately, a lot of other things can mimic the symptoms of fibromyalgia. And if you're not looking for those other things and not treating it, unfortunately, doctors are just saying, well, I don't know what's wrong with you, and they label patients with the diagnosis of fibromyalgia. And that's not to say that there are not patients out there that truly have it, but you need to rule out these other things.
Okay, let's talk about what those things are.
Hypothyroidism. Unfortunately, doctors are commonly using a screening TSH to make that call. Unfortunately, in women, it's not always reliable, so you need to look at the overall symptom complex and doing a more exhaustive thyroid screen, including T3, T4, and reverse T3.
Okay.
Testosterone deficiency, very common in women, can mimic the symptoms of fibromyalgia. Vitamin D deficiency, simple vitamin D alone.
Which is huge, by the way, for a whole scope of things you share.
Almost all of us are around here, even in Arizona, have low vitamin D levels, and if they're severely low, they'll cause fibromyalgia symptoms, the muscle, joint aches and pains, the fatigue, and then lastly, throw vitamin B12 deficiency on top of that, or any combination of those four, you're in trouble.
Well, can we take vitamins for this to feel better?
Actually, one of my worst patient cases, I had a doctor's wife who had been vitamin D deficient, but was labeled fibromyalgia for 15 years in devastating incapacitation, got her on vitamin D, and she was a new person in a week.
Seriously?
It was astounding.
Because a lot of times they associate lack of vitamin D with depression.
Oh, yeah.
And
absolutely.
I can see how this might get a little bit tied up and confusing when it comes to menopause.
Oh, yeah, because by the time we're 50, 1 in 3 of us are going to be hypothyroid. We got estrogen and testosterone deficiency, all which helps that muscle, energy, and pain. It's just getting those simple things fixed, and then after we get all those balanced and they don't have that good feeling, they still have the muscle aches and pains. Now we're talking a true fibromyalgia patient, and they would benefit from fibromyalgia specific treatments such as exercise, getting sure that they get plenty of sleep, and then medications specifically like Lyrica or Savella for fibromyalgia. But don't let somebody give you that diagnosis unless you've had your thyroid, your hormones, your vitamin D and B12 checked.
Okay, and the treatment options you just mentioned, and that is, again, exercise,
sleep, getting, yeah, right.
What's that?
Yeah, Mom. Sleep, a good night's sleep, and there's sometimes medications required to help them get good rest. Good diet, clean living is appropriate, but again, if those don't do the trick, there are medications now that target fibromyalgia specifically.
Thank goodness.
Yes.
Because when this first came on the scene, I remember reading about kombucha tea and things like this that people were taking to feel better.
And be careful. There's a lot of lousy things out there that people can be taking that they're getting ripped off, frankly. So make sure whatever supplements you're taking or whatever you're doing, that they come from a reputable source, that they're clean and your doctor recommends them.
All right. I know you guys do blood tests for this and a whole myriad of things.
Oh, yeah.
We just need a friend like you in our back pocket to tell us what's going on.
Well, you do have a friend like me in your back pocket.
And thank you for that. I appreciate it. All right. We're going to put more about this up on our hotline. Thank you for being here.
Oh, it's always a pleasure.
Color is beautiful on you.